everybody. It's a pleasure to have you here this morning. It's 9:30, so I propose that we start this workshop. And as the director for the People Directorate in DG Research and Innovation, it's a great pleasure for me to welcome you to this event on the social value of arts and culture and the impact it has on well-being, mental health, and inclusion for everybody. I am also an art and culture lover, and I believe that we all share the same feeling of the importance of the arts and culture, as well as care for ours and other people's well-being, mental health, and inclusion. And my professional and personal interest really stems from the fact that art is a universal language. It's also a perennial language since the first footsteps taken by our ancestors at the beginning of mankind. The arts can be defined in many ways as the concept is based on our culture and our values, and the arts communicate to us matters that cannot be communicated by any other means, and they affect us all in different but unique ways and in different forms. The experiences that will be shared by the projects presented today will certainly concur to a much broader and holistic approach of well-being beyond the how to promote overall health and mental health and how to prevent and cure mental illnesses. When well-being aspects are neglected, this is often where mental health issues usually develop. Arts and culture have a unique role to play in this setting, and it allows us to conceptualize well-being and mental health far beyond the classical tick in the box exercise. A person's well-being is much more than just that the person is living with a condition that could be labeled either medically healthy or not. And the figures are staggering. We are aware that the burden of mental health disorders is among the top 10 leading causes worldwide, with no evidence of reduction since 1990. We are living in a world where 20% of all the children have a mental health condition. These children are the makers of the future. We need to take care of these children as well as of people of all ages and all population segments. And many people are suffering from loneliness and anxiety in these restless times when the pandemic is still kind of ongoing. We have the war in Ukraine, which is ravaging lives of many in their countries and beyond. And these events affect us all in many different ways. Unfortunately, these turbulent times we experience today will not be over in the near future, and therefore we need to invest substantial resources on research in the positive impact of arts and culture on people's well-being and mental health. In addition to using different scientific and practical approaches in several of the fields involved, like the biological, medical, as well as the social, cultural, and socio-economic ones. But still many challenges remain. Therefore, to progress the policy development, it's really important to continue to support the synergies between the arts, culture, and mental health policy. And the Commission's communication on a comprehensive approach to mental health that recently has been published is calling for the best and promising practices using or focusing on mental health promotion, prevention, early detection, and early intervention. In this context, we have mapped the research and innovation projects and activities on evidence-based good practices, guidelines and policies for uptake in health and care systems. We also initiated a dialogue with key stakeholders in the context of the Research and Innovation Days last year, and we have continued to the Joint Commission and European Parliament high-level seminar on culture, a driver for health and well-being in the EU. Therefore, we look for new research and innovation findings, which can serve for designing new policy recommendations, evidence-based guidelines, best practices, and interventions. And I very much count on you for sharing your examples and best examples. We have already achieved a lot. Several calls for proposals on mental health are available in the Horizon Europe work programs. We have had 7 calls in the Cluster 1 Health, such as on clinical aspects and treatment for mental disorders. There has also been 7 calls in the Cluster 2, Culture, Creativity and Inclusive Society, like addressing the socioeconomic impacts of loneliness and etc. We also have a flagship on the brain health in preparation that will include mental health and well-being. But we would now take a step further. The arts and culture provide effective economic and concrete means for solving mental health issues. And we are identifying research and innovation research fundings that can be upscaled and further translated into policy and tangible actions for people. Social sciences and humanities projects for art and health are transdisciplinary by nature. They are central to people's well-being, mental health and inclusion. And here we have supported 32 research projects amounting to over 94 million in Horizon 2020 and in Horizon Europe so far. For Horizon 2020, the projects stem from the Works Programme for Societal Challenge 6, Europe in the Changing World, Inclusive, Innovative and Reflective Societies. And for Horizon Europe, they are funded under Cluster 2, Culture, Creativity and Inclusive Society. These projects focus on artistic and cultural interventions that engage people with the arts, in person or via digital means, as using the COVID-19 pandemic. And indeed, people and patients who participate in artistic and cultural activities remain engaged and are exposed to fewer side effects compared to people and patients involved in medical interventions alone. So new creative avenues for mental health is looked for, and the projects we have supported provide many creative ideas to address mental health from different angles for different population segments, including vulnerable groups such as displaced people, refugees, or people in prison, and ultimately promote an inclusive and fair European society. We know that socioeconomic determinants and inequalities are key indicators for mental health risks, but they also represent opportunities around which some of the calls for proposals are structured. And we are convinced that an inclusive and life course perspective promoting the arts for well-being will generate important societal and mental health benefits for preventing and lowering risks such as loneliness, for instance. New research fundings also promote the concept of the culture on prescription, which is emerging promising across several member states. Now coming to today's event, we will learn more specifically about 6 EU projects that was funded from Horizon 2020 and that provide evidence for opening new avenues on how to experience and engage with the arts has an overall positive impact on well-being and mental health for both individuals and society. These artistic opportunities will bring people living on the margins of society and even beyond closer to its heart, helping them to find their legitimate place and contributing to a more inclusive society. We will hear why and how these projects are successful in engaging and empowering in an inclusive manner citizens and stakeholders, including policymakers, measuring the tangible and intangible value and impact of the arts and culture for well-being and mental health in particular. How the arts and the scientific methods can be integrated together by various participatory and multidisciplinary approaches when working with people. And this inclusive approach will require, in greater extent, citizens' engagement and participation of all parts of society, both in urban and peripheral regions across Europe. The future for people's well-being and mental health and inclusion is important, and we will need to take the next steps and complement existing psychosocial approaches to measure the societal value and impacts of arts and culture with the effects of the people's personal well-being and mental health. And in doing so, we will contribute to reinforce people's own identity and purpose of life, as well as their sense of belonging to society. And I am convinced that we together will find novel and unexplored solutions to mental health, as well as offer people simply more opportunities to enjoy the benefits of art and culture. And I hope that you will enjoy this morning's presentations that are opening the doors to the art and culture and for the well-being and inclusion of all of us in the European society. And I am really looking forward to your active participation in the workshop. And we very much look forward to learn more about the outcome of this workshop. And with that, I will wish you all a very, very good workshop today. And I will now hand over to the moderator for the morning session. And that is my colleague Christine van Goey, who is the head of Unit for Inclusive Society in the Research Executive Agency. Christine, over to you.
Thank you, Irene, and good morning and very welcome also from my side to all the participants. I see we're quite numerous, so that's very good. So I'm Christine van Goey. I'm head of unit in the Research Executive Agency, and we are this commission agency that is implementing large parts of the research framework program Horizon 2020 and now Horizon Europe as well. So in my unit specifically, we manage research projects in the area of inclusive society, and of course the 6 projects that are on the agenda of today are also key of that. But we do not only manage them. We also promote cluster initiatives across projects during their life cycle to foster synergies and as the event today, also to create as much as possible opportunities to harvest policy relevant outcomes, because that's of course key to create a good impact. So this morning, I have the pleasure to moderate this first session of the day, dedicated on societal value of culture and the impact of cultural policies in Europe. In this first session, we will listen to all the great experiences of 3 projects funded under Horizon 2020. And we will listen to them, especially to the good examples they came across in their projects, the good examples of arts and culture for well-being, mental health and inclusion that could be replicated, as well as best practices that have been developed under those projects and that can be used by stakeholders and policymakers. Another project will also focus on the methods to use to measure the impact of arts and culture for well-being and mental health. And then all of them throughout the project, they have been reflecting on future avenues and needs in the field. So let me, and then little by little, we will start giving the floor and listening to you. So we will, as you have seen on the agenda, there are 3 projects. The first will be Invent, which is a consortium led by the Erasmus University of Rotterdam. The next project for today is MESSOC, which is on the measuring of the social dimension of culture. The project, by the way, ended a few weeks ago. It's led by the University of Valencia. And the third project is Uncharted, understanding, capturing and fostering the societal value of culture. And that a consortium is led by the University of Barcelona. Before giving the floor to the first speaker, I would also like to invite the participants to share your questions via Slido, and this can be already done during the presentations, I was told. After the 3 presentations, there will be 15 minutes session Q&A, but it's very good if you could already share your questions or comments or feedback via the Slido during the presentations. So I would like now to invite the first speakers of Invent. And as I said, it's a project led by the Erasmus University of Rotterdam. I'm not sure who will take the floor as first. Is it Professor Susanne Jansen or Professor Mark Verboort? But please, the floor is yours.
Thank you for this great introduction. Can you hear me?
Yes, we do.
Okay, thank you. My name is Susanne Jansen and I'm the coordinator of the Invent project, and I'm very pleasured to present at this important event on behalf of our project. Over the last 3 years, the Invent team has done extensive fieldwork to map and qualify the societal values of culture as experienced by people from all layers of the population in 9 European countries. We did a comprehensive survey among representative samples of the population in Croatia, Denmark, Finland, France, the Netherlands, Serbia, Spain, Switzerland, and the United Kingdom. Altogether, more than 14,000 people completed our survey. We also conducted 36 focus groups, 27 case studies, over 200 interviews, 3 waves of data scraping of social media content, and a smartphone study with experimental stimuli. Last but not least, we did extensive literature research and secondary data analysis. Today, I will share some of the many important findings that emerged from our project and from our analysis of this rich empirical data. I will focus, of course, on findings that highlight and qualify culture's contribution to well-being and health, although we also have evidence of culture's contributions to these other societal values. First of all, our studies clearly indicate that cultural participation is positively associated with overall life satisfaction, well-being, and mental health. Drawing on our survey data, we found a clear positive association between life satisfaction and engagement in a wide spectrum of arts-related activities, both active and receptive activities. I should note that we also found a clear positive association with engagement in other leisure activities such as sports and exercise and visiting recreational areas. Third, we find that people's satisfaction with the cultural offerings in their immediate environment also significantly contributes to their overall life satisfaction. And we see that these positive effects remain significant after controlling for other relevant variables that impact life satisfaction, such as education, income, and age. Importantly, we did not find a significant correlation between life satisfaction and overall engagement in digital activities, while we found a negative association with engagement in digital entertainment. Our in-depth interviews and case studies yielded important additional insights. Our interview participants first and foremost associated well-being with wider societal conditions such as economic stability, safety and social security, good infrastructures and facilities, and especially with being physically healthy and having sufficient financial means. Still, many participants highlighted how, in times of crisis, sickness, mourning, and uncertainty, culture activities and immersive cultural surroundings can relieve one's pain and suffering. They also stressed that well-being strongly depends on social interactions and joint activities with friends, relatives, and like-minded others, but also on a sense of connectedness with the wider communities to which they belong. Such community well-being is advanced through shared cultural experiences, friendly and respectful interactions with others, and experiences of social solidarity and inclusiveness, but is also a result of being part of a culture in the broad sense. In turn, we find that the lack of social cohesion, insufficient opportunities for participation, intolerance, discrimination, or exclusion is detrimental to community well-being. When specifically asked about cultural activities that contribute to their well-being, our respondents mentioned a wide variety of cultural offerings, including arts-related activities, but also traditional festivities such as carnival celebrations or food festivals. And they also mentioned entertainment, media entertainment, religious practices, socializing with other peoples, and again also sports and exercise. Interviewees more often mention so-called receptive activities, such as listening to music, rather than creative activities, such as making music. But of course, this has to do with the thresholds. The threshold for these creative activities tends to be higher. They also mentioned things they can do individually quite often next to cultural activities they do together with others, although they consider the social aspect of joint activities with other people highly important to their well-being. Lastly, our respondents made it very clear that environmental and infrastructural factors strongly impact their well-being. So not just things they choose to do themselves. They point to positive well-being effects of a beautiful living environment, the presence of artworks and other aesthetic elements in public spaces, hospitals and other buildings, the presence of nearby green areas and attractive public spaces to socialize with others, and last but not least, a good variety of cultural offerings in the place where they live. Moving to the digital environment, our research suggests that digital cultural participation has significant potential for improving well-being, but is not a substitute for offline cultural participation. And also in this case, digital inequality should be considered. Various digital culture activities and platforms appear to contribute to both community and individual well-being by advancing social connectedness and feelings of belonging to both local and transnational communities, but also by reducing feelings of loneliness and isolation, and by enhancing empowerment and development and expression of the self. This holds especially, on the one hand, for recent migrants and refugees, and on the other hand, for people who are less mobile, such as elderly people and people who are ill or have a disability. However, our research also indicates that digital cultural participation, by having added value, is not a fully fledged alternative for engagement in offline cultural activities. Moreover, we find evidence of a persistent digital divide which impedes the engagement of specific groups in digital culture, such as elderly people, lower educated people. Considering this overall positive contribution of cultural participation to well-being, it's vital to tackle persistent social inequalities in cultural participation, both within and between European countries, because we find major disparities in the extent to which citizens engage in a broad range of cultural activities. A substantial group of our survey respondents, about 10%, do not engage in any offline or online cultural activities, and we really investigate a very broad range. These respondents are more likely to be older, lower educated, unemployed, single, religious, live outside of large cities, and have lower income. And for almost a quarter of respondents, an additional quarter, engagement in both offline and digital cultural activities was proved to be very limited. Moreover, we find important cross-international differences in the proportions of citizens who currently do not participate in cultural activities or do so only to a very limited extent. Our studies thus revealed many significant and positive associations between cultural participation and well-being. However, we would say that we need advanced research and methodologies to grasp the precise factors and mechanisms that account for the health benefits of specific cultural practices to make deliberate interventions in the realm of health and well-being. What we need is studies that systematically assess and compare the specific well-being affordances and effects of different types of cultural practices. So comparisons of, for instance, active and receptive arts-related activities, but also comparisons between online and offline participation in cultural activities. Such systematic comparisons are currently largely lacking. We also need comprehensive cross-national and longitudinal survey data, which include extensive measurements of both health and well-being and cultural participation, to assess the connection between culture and well-being in a more rigorous manner, specifying the role of intervening variables and disentangling the effects of individual level and contextual factors. The current EU-wide surveys, such as Eurobarometer, still only occasionally pay attention to culture with special Eurobarometers. The last Eurobarometer paying extensive attention to cultural participation and access to culture dates back to 2013 and did not examine the link between cultural participation and health being, at least not in any comprehensive way. So we would recommend devoting a special Eurobarometer to this issue in the near future. We also need smart and innovative methodologies to better capture the well-being effects of people's engagement with culture. And at this point, I gladly give the floor to my colleague Mark Verboort, who will tell you a bit more about the smartphone study we conducted as part of our INVENT project. Thank you.
Thank you, Suzanne. Can everybody hear me?
Yes.
I'll continue. So one key objective of the INVENT project was to develop new methodologies for measuring cultural participation, in line with the call on social values of culture. One of the approaches we took was the employment of experience sampling methodology, ESM, to examine how people experience culture in daily life and how it links to well-being. Basically, experience sampling methodology consists of sending short questionnaires to people which they immediately fill out. This is done several times per day, for a week or more. Nowadays, smartphones are used to get the questionnaires delivered. Respondents install an app and the researchers send the questionnaires. The method originates from the field of psychology to help people with mental health problems. In the field of culture, it has mostly been used to study the impact of music on moods or social media use on subjective well-being. There are at least 3 advantages of the method. First, we get more in-depth, ecologically valid measurements of cultural participation. There is no memory bias because the questions are about what respondents very recently did. Second, we can measure phenomena from daily life which are difficult to measure via regular surveys or interview methods. For example, how often individuals have conversations about culture. Third, we can measure how people feel at a certain moment and can connect this to the activities they have just done. We can thus connect well-being to cultural participation. What we did, we found respondents and asked them to download the app Empath, which is a tool developed for ESM. All respondents received instructions how to do this. First, we sent an intake questionnaire with a consent form and questions on their social background, plus a baseline measurement of their subjective well-being. Second, if they had given consent, we sent respondents 4 questionnaires per day for 1 week, 7 days. Every questionnaire asked how the respondent felt at that moment on a scale from 0 to 100. That was our measure of subjective well-being, in line with previous studies. And then we asked whether they had participated in culture in the hours before they received the questionnaire. We had 2 versions of the questionnaire. 2 times a day we asked about participation in a cultural activity, and 2 times a day we asked about participation in a cultural conversation. In both cases, if they said yes, we asked for more details. What exactly? Where? With whom? If they said no, the questionnaire ended. 348 respondents participated in our study. In total, 9,516 questionnaires were sent. More than 6,000 questionnaires were also answered, which is 67% compliance, which is good. So what can we say about well-being? Our design enabled us to conduct a semi-experimental study. We can compare the subjective well-being in moments when respondents had just participated in culture with the moments in which they had not. In an experimental design, you would have people in a stimulus condition versus a control condition, but only once. ESM enabled us to have multiple observations for the same persons, increasing reliability. Sometimes respondents are in a stimulus condition, sometimes in a control condition. And this is done in a natural environment, not in a laboratory, so it is more ecologically valid. Also, in our study, we control for social background and for the amount of well-being at the time of the intake survey, because there could be differences between people in terms of their baseline well-being. All in all, we find clear positive, significant effects of participation in culture, both for activities and for conversations. So people have higher well-being if they have just participated in an activity or have just participated in conversation. Effects are higher if culture is done outdoors and with other people. It is lower if culture consists of audiovisual entertainment or reading the news. There are challenges. Convincing respondents to install the app is difficult because it takes trust. Also, the survey needs to be short, maximum 2 minutes, so one cannot ask many questions or give long definitions of culture. And some respondents drop out because of survey fatigue. Still, ESM is a very promising method for measuring subjective well-being or mental health in relation to arts and culture. It can generate very precise information on how people feel and link this to what they are doing. Our study was exploratory, but showed the potential for future research. Thank you.
Thank you very much to both Professor Janssen and Professor Verboort. I think it was very interesting to listen to your experiences, and also very good that you shared this extremely concrete experience with the app. So now I would like to continue and give the floor to the second project of the day. It's MESOC, led by the University of Valencia. I hope the speakers are around. It's Professor Rosel Koster and Professor Molinari.
Yes.
Please,
hello.
the floor is yours.
Good morning. It's a pleasure and an honor to be here and to feel co-participants for Europe and the European Commission vision at such a complex issue as the relationship between culture and well-being in general and health in particular. We have tried to unravel some of these relationships in the MESOC projects for the last 3 years. And now we are going to try to share them with all of you. However, in order not to waste time, and since Francesco Molinari, our experienced project manager, has much better English than I do, I will pass the floor to him. Thank you, and please, Francesco, go ahead.
Thank you. Good morning. Can you hear me fine?
Yes?
Yes, okay. Thanks, Pau. Thanks to the organizers of this event on behalf of the MESOC consortium, which was composed of 10 partners from 7 European countries, including 3 cities as partners and 8 more as associated members, which also took an active part in the testing phase of the project I will report to you about. The project MESOC stands for Measuring the Social Dimension of Culture, was conceived of right after the publication of the new European Agenda for Culture back in 2018. And we actually drew on some of the priorities established in that crucial document in terms of definition of the so-called crossover topics or themes for the identification of the societal impacts of culture, notably health and well-being, social cohesion, people's engagement and participation, and finally, urban and territorial renovation. focusing on these three themes, the mission of our project was to propose and also validate a collection of methods and tools which are all available in the public domain. Now, as it was mentioned, the project has just finished its lifetime, and we are we have gathered all this information on our official website, which is mesoc-project.eu, which will, of course, remain available for the time being in order to document our results, but also to ensure further take-up by new research communities. The mission was finalized in a number of concurrent and in some cases intertwined methods and tools, including the support of artificial intelligence and machine learning, especially for the analysis of texts describing successful experiences of cultural policy or cultural practice. It should be borne in mind again that this project was conceived of in 2018 when there was no evidence around us of the now very successful and open tools for the involvement of ordinary people in advanced search using artificial intelligence. At that time, there was no knowledge, and we had to develop many of the algorithms from scratch. But still, we also have had the opportunity of merging our results with the new tools being available in the public domain, thanks to the contribution of several huge companies with enormous investments in the background, and we are proud of saying that there is a good convergence between our results as they were generated with our own resources and the contribution of these very important and long-lasting tools which are now available to everyone. Having said that, not before thanking individually the representatives of the 11 cities involved in this project, which are Athens, Cluj-Napoca, and Rijeka as members of the consortium, and additionally Barcelona, Jerez de la Frontera, and Valencia from Spain, Ghent from Belgium, Issy-les-Moulineaux from France, Lublin from Poland, Milan from Italy, and Turku from Finland, I will spend the remaining part of my talk by answering to three main questions. The first being about which good practice examples of arts and culture for well-being, mental health, and inclusion we can bring to the attention of today's audience. The second question being about the methods we have elaborated to measure the societal impacts of arts and culture, and especially those on well-being, mental health, and inclusion. And the final feedback will be on the request to reflect on future avenues and needs for research and policy in this domain. Let me start by the first point. We have had several case studies in our project, but based also on the evidence of those case studies, it is important to mention, first of all, that we have developed a conceptual model which we named, not by chance, convergent, because it lies at the crossroad of several theories, but also pieces of evidence, focusing on the connection between the cultural experience and the generation of some of the psychological and also social effects we are looking for in all of the projects presented today. The interesting part of this model is this distinction, the distinction it places between the generic cultural experience and a specific experience which is generated not by chance, not by purpose, um, depending on the cases, because the individual person engages itself on or herself in the cultural activity, or because there is a deliberate involvement from cultural institutions or cultural operators of the beneficiaries of cultural consumption in these specific practices. In any case, we have introduced the concept of resonance as a synonym of this deliberate intention of exercising some kind of effect on the cognitive, emotional, or aesthetic perception of people as being part of something bigger, a bigger community, a bigger environment, and this echoes the results of the survey that were presented by the previous speaker today. Not all the cultural experience have resonance. And so for us, the challenge was to describe which conditions should be materialized in practice in order for the cultural experience to generate its effects, especially on the well-being of people. And based on the evidence from the field experiments, we have identified a number of factors which can be clustered in 5 broad categories. The first being the existence of networks and partnerships, therefore the community dimension or communitarian dimension of culture and cultural practices. Second aspect is the availability and mobilization of adequate resources in all senses and infrastructure. Third is the ability to influence changes in rules or regulations, as in many cases there is a mismatch between the requirements of resonance and the general framework within which cultural practices, but also policies are developed. The fourth aspect is related to the dissemination of the meanings and the narratives created across the cultural activities. And the fifth aspect is how to achieve scaling up especially of knowledge and abilities. All these aspects will be reflected in the third part of my talk when it comes to identifying the recommendations for future action. Now, going to the second part of my speech, I will briefly overview the methods and tools that we have developed, which cannot be presented, especially without any slide. But again, I am making reference to our official website, mesoc-project.eu, because all the contents I will be presenting are on display there. The first very interesting application of artificial intelligence is the so-called SICRED tool. SICRED stands for Societal Impacts of Culture and Creativity on Regional Development. And this is basically an application starting from available statistical indicators at the level of European regions to assess at the level of regions, so individual regions, what kind of influences can be detected between cultural indicators and other indicators related to quality of living. Here, of course, we have to tackle the issue, which is not peripheral to our project, that cultural indicators, cultural statistics in general, are lacking to some extent the needed level of depth and informative value that would be required in order to be safe in drawing conclusions from the analysis of data. But at least at the level of a provocation, our model, which enables to go one by one into the regions belonging to this panel, most of the European regions, although not all of the EU member states are in this collection due to lack of data, basically, in order to assess whether the evidence we have on culture has influence on education, health, income, jobs, satisfaction about life, environmental quality, and so on. Each of these connections are accompanied by multipliers indicating the intensity of the effects. And what we have found out is that the dimension that shows the largest and most widespread effects is exactly the health dimension. This is where we can measure the biggest impacts from cultural activities in most of the regions involved in this experiment. The second tool which is worth mentioning is the so-called Serapeum, which can now be compared to a great extent to some of the existing tools I mentioned earlier, which enable doing search or making questions to the machine. Basically, this tool was developed starting from a repository of several hundreds academic papers and abstracts, also accompanied by policy texts dealing with the societal impacts of culture and especially describing relevant case studies. Based on this collection, the Serapeum enables a user to extract information from those texts, and especially information on what we named transition variables, defined as elements of the context within which a cultural policy or a cultural practice is developed, which can be concretely measured and therefore avoid the usual impasse that when it comes to impact measurement or impact assessment, the concept itself is so vague that we cannot even tackle the issue from a methodologically sound point of view. And this evidence confirms that there is indeed generation of public value from cultural policy and practice. This is applicable to both individuals and groups. And what is also interesting is that on the Serapeum, we have developed a taxonomy accompanied by a thesaurus, which displays visually the causal relations we have spotted from the textual analysis of this repository of documents. It is always hard and challenging to speak of causal relations rather than mere correlations, but what we can say here is that by also using the newest tools now in the state of the art, the evidence we have with us has been mostly confirmed. A third tool which is worth mentioning, but there would be others I have no time to talk about today, is the so-called How Culture platform. This is a web and mobile application which we have developed internally at the University of Valencia and tested during the project, which aims to capture the feedback of cultural consumers right at the point of experience. This is other than responding to a survey. It is about receiving an SMS on including certain questions on a theater play right at the time when the person gets out of the theater. This is, again, something used in the marketing area, but hardly developed until today in the cultural cultural related science, so to speak. And what we also have in this platform is an attempt at profiling the behavior of users according to cultural types, depending on their individual approach to culture consumption, and also as a way to reward the participants against the feedback they voluntarily provide to us as to any organizer of a cultural event, or even better, any agency putting money in a certain cultural initiative and wanting to know more about the individual impacts on people, going beyond the sheer number of attendees, which currently is one of the very few statistics available to this purpose. Now let me finalize my talk speaking quickly of the recommendations we have developed, especially in the context of our final conference, which we held in Paris in the beginning of March, where we also released the so-called manifesto, or MESOC manifesto, or Paris manifesto, which you can also find on our website as well as on change.org, which we have also disseminated among the partner cities and also additional cities to raise their attention on the importance to do a quantum leap in the advocacy of the relevance of arts and culture for societal development. And this is related to the fact that until today, as it was confirmed by the collection of documents we have done and the analysis of those documents, too little rigor and analysis of replicability potential affects the available narratives on the outcomes and the impacts of cultural events and activities. This is paradoxical because we are now experiencing, and today's event confirms this, an interesting convergence of several disciplines going from medicine and behavioral science to artificial intelligence and machine learning, but also bearing in mind urban studies, analysis of innovation and participation methods and tools, and so on. And at the crossroad of all these disciplines, it is indeed possible, in our opinion, to create a new set of protocols which deepen the analysis on the connections between culture and, generally speaking, well-being, also keeping the distinction we have valorized in our project between the micro level, the individuals getting out of a theater, the small groups, the meso level, communities, cities where we had our own field studies, and the macro level, including the regional analysis I was mentioning before. So what is needed is to define a new research agenda, which of course must be supported by policy, to define and describe the direction, the dimension, and the causality of societal impacts in ways that can become immediately useful to both cultural operators, who are obviously interested in evaluating the cost effectiveness of their initiatives, and cultural policy makers, particularly those willing to concretely include culture in their own strategies, programs, and plans aimed at societal objectives. In this context, we have two concrete examples or proposals to share. The first is about moving a certain percentage of public expenditure in healthcare from the prevention of mental diseases to the promotion of cultural events. In other words, less money for pills, more money for theater plays. This cannot be done without establishing a sound and firm evidence, which we are pretty sure already exists in the state of the art, but only needs to be systematized and also build on firmer grounds. And this will be the last part of my conclusion. The other proposal is about setting aside another percentage, say 5% of the public budget available for cultural projects, programs, policies to develop a new battery of indicators. Why? Because the existing ones are not enough, and also because the logic behind existing indicators is no longer compliant with these innovations I also spoke about in my talk, which call for different approaches and different sources of data and different ways of creating evidence to support cultural operators and policymakers. This has to do also with the involvement of the national statistical institutions as well as Eurostat and UNESCO that are separately engaged in very important efforts to improve the current battery of indicators and also their harmonization. I believe we can be part with our consortium, with our ideas of these efforts for the time being. So let me conclude with the reference I already made to new avenues for making more evident the interpenetration between culture and health. In very short words, we identified 4 P's to characterize the next steps. P's stand for pathways, protocols, partnerships, and policies. As far as the pathways are concerned, as I already mentioned, we need to explore further the bio and behavioral mechanisms connecting resonance and cultural experience in general with their likely and documented consequences on individual and collective actions of consumers and prosumers of culture. This type of research requires collaboration among numerous areas, multidisciplinary areas, including medicine, neuroscience, behavioral science, social science, and the contribution of the artists and the cultural producers themselves. The second P stands for protocols. What is missing here is more rigorous definitions of the trials that need to be carried out to develop, to produce agreed and uncontroversial evidence on the positive effects of culture on health. This is similar to developing guidelines for clinical trials. As an example in that direction, we in MESOC have developed and offered to the public domain one of these possible protocols and guidelines. The third topic, the third P, is about partnerships. I didn't mention that enough, but many experiences we have spotted in our research are experiences of cooperation. Cooperation between operators, which also include social health institutions alongside cultural operators and policymakers. So this is the starting point. We need to move away from the logic of episodes, contingent and temporary collaboration experiences, and implement stable and long-term partnership agreements among these actors. And finally, the fourth P is obviously about policies. It is not possible to imagine anything of what I mentioned before without a more narrow focus of policies, both cultural policies and health and well-being oriented policies on this convergence, which is sometimes even difficult to describe, but we have documented as existing and bringing fruitful consequences at all levels. We have focused our analysis, including the local level, the city level, as I mentioned earlier in our case studies, as well as the regional level and the national level in our attempts at defining and measuring this phenomenon. This is it. I remain open to your questions, and I thank you for your attention. Thank you.
Thank you very much, Professor Molinari and also Professor Rossell, for this interesting talk. I think it really shows the wealth of the project MESOC. Regarding questions, I would like to remind the participants that you can send your questions to the Slido, and it's now currently also available on the screen, because immediately after the next presentation of the project Uncharted, we will start a Q&A session. Let us go now immediately to that presentation, because we're already a little bit behind schedule. So I would like to invite the speakers of Uncharted led by the University of Barcelona, Professor Rodriguez Morato, and also Professor Silva from the University of Coimbra. Please, the floor is yours.
Thank you very much. Thank you very much. My name is Arturo Rodriguez Morato from the University of Barcelona, and I am the coordinator of Uncharted. I will be brief because I understand that we are late already. I will start by briefly presenting the way in which this project addresses the topic of the connection between culture and well-being. And then Silvia Silva, who is one of the researchers of the project from Coimbra University, will present some key findings of the project in this respect. The project Uncharted studies the values of culture as they emerge and are managed across all the different areas of the cultural sphere, not only in cultural participation, not only at the time that the individuals attend artistic activities. This is one of the frameworks that we study, but there are another important framework in our project, that is cultural production and heritage management, and a third one in cultural administrations. Our project does not focus in particular or specifically or in an isolated way on well-being, but on the plurality of values and valuations that appear in the everyday practices of social actors within those different areas of cultural participation, cultural production, cultural administration. We have adopted a qualitative approach, and within that approach, we have developed an extensive series of carefully selected case studies in all these three areas, doing interviews, doing focus groups, participant observation, document analysis, and other techniques. And we did that in a significant number of European countries, in Spain, in Portugal, in Hungary, in the UK, France, Norway, Italy also. Throughout those case studies that were organized in a process that followed an inductive logic, we have first focused on identifying the different kinds of valuations that actors make, these publics that attend an artistic performance, but also other kind of actors, creators that participating in producing an artwork, a cultural work, or administrators, cultural administrators that consider different cultural plans, evaluate different cultural projects, decide on fundings, one thing or another thing. Then we have analyzed the ways in which different valuations confront each other, creating tensions. For us, that was very important to see the way in which they interplay, these valuations, the social mechanisms that intervene in mitigating tensions in these valuations. Well-being valuations prominently appear in cultural participation practices, where well-being is a central value. And this is why Silvia Silva will concentrate on that area. But but well-being is also present in processes of cultural production, often in confrontation with other values, with aesthetic values, with economic values sometimes. And of course, well-being is an objective for cultural policy too, even if in a very diverse degree in different countries. It is, for example, more explicit and more important in Anglo-Saxon countries nowadays than in Mediterranean countries. But anyway, they are increasingly present and more important everywhere. Anyway, in cultural practices, well-being as a value is never isolated, neither in individuals nor in society at large. Valuations are always plural, and different actors that interweave in cultural life act on the basis of contrasted configurations of values. Our study shows the continuous interplay between different values attributed to culture and between actors of different kinds moved by these different valuations. An important lesson to be taken from this evidence is that the effective promotion of well-being through cultural activities can only be done on the basis of a convenient management of that interplay. Future research on the connection between culture and well-being, looking for understanding their associated effects on health, should take this into account. That's our view. Should include this crucial context in the analysis that many times is not taken enough into account, I would say. And this is my main point to make. Now Silvia will present some more specific perspectives on that connection between culture and well-being provided by the work done on cultural participation practices within our project. Silvia, please.
Thank you, Arturo. Thank you very much. And thank you all for being here, all the participants still. So thank you very much. Well, as mentioned by Arturo, and I'm going just to jump in some of the ideas that we believe that are key for this discussion. So as mentioned by Arturo, the relation of culture and well-being was really not the main focus of our chart, but we believe that this spontaneous mention of well-being, it can well actually represent the importance that the participants attribute to this interplay of art and culture and well-being. So here I'll focus on three main ideas that are based on the data collection through the case studies that, as Arturo mentioned, was several and scattered along several countries. And these three main ideas, they reflect the complexity of the relation of arts, culture towards health and well-being. And thus, this is key to have an integrated approach when thinking on future avenues and needs in this field. So this will be the focus on my brief sharing with you. So hopefully some food for thoughts, as we usually say. So the first idea is to acknowledge the complex framework of attributing value to participation in arts and culture. Arturo already mentioned some of this complexity, and we have the data that we collected showed that three factors: the content, the social trajectories, and the context, and three levels: the internal or personal, and external or social, and the contextual or political. All of these are key when understanding evaluation in practice. That is what we are focusing here. Well, I'm focusing here. So the interplay and the intersection of these dimensions, it is key when planning interventions connecting arts, culture, and health and well-being, both at an individual and a community level. Specifically, we saw that in cultural participation, well-being is a big group that encompasses various meanings and interpretations, such as pleasure, hedonism, but also relationship, social link, fulfillment, or personal development, just to mention some. And this well-being as a big group, it is very intertwined, very closely with other big groups, such as identity, for instance, as recognition, dignity, or integration. The other big group is with democracy, with, for instance, participation, inclusion, and expression, but also aesthetics, with creativity and interiority. So, well-being appears as a value intertwined with other values, and reflecting how valuation processes is dynamic. And based on our data, it is determined by the meaning of these central factors. So the influence of the attitudes that I refer to, the social trajectories, the spatial-temporal context, and the actual content of the art piece and the artistic practice. But we have also, as I mentioned, the three levels that we believe. At the same time, valuation also, of course, in an internal personal level for oneself, at an external or social level by or for the group involved, and in a contextual or political level for the society at a larger scale. So this is based on the data that we collect through the case study that we analyze. So it is quite visible in these case studies. For example, in the internal or personal level, this relates to with having fun, pleasure, and escape from routine, counterbalancing the inactivity or a stressful phase. And I have here some quotes that I want to share with you from the people that we talk with that given concrete voice to this analysis. So one person said, it is essential for my well-being, for my balance. I speak for myself. I do this with great pleasure because I like to work with a poem. This was a workshop with the poem women, with a culture-based creator. And she said, well, I like the smell. And then creating an object makes me like it even more, to be inventing something. Another person in another case study said, I am transversed by the vibration of the sound. I am in it as if it were a liquid. I forget everything. I swim in the sound, in the vibration, in the beat. It is one of the greatest pleasures of my life, if not the greatest. There is a trance or a spiritual dimension, really, when there is this state close to meditation, you are focused on the present moment, on what you feel. You let your thoughts pass, you don't hold them to them. It helps me to connect with the present, to my body. And this was a case study developed in France. So on this internal level, we have these reflections, but also not only empowerment, pride, personal healing processes, or recovering identity and gaining pride. Another person said, for those women that experienced this activity, it was therapeutic and liberating because they were not allowed to do this back in their country. And another said, I used to think that this was a job that diminished people, and I did it not at ease. My sister, she did it behind us, everyone's back. It was a shame. But now she's starting to change that. So it is some very powerful insights on this. So creativity, having a space that allows things just to happen, as they mentioned, and involvement in the processes, and making with one own hands, or the process of creation, connecting with the sensorial nature of the materials involved, for instance, feeling and experiencing. It facilitates an emotional connection that imprints in the memory, being therapeutic and relaxing. So this is in an internal level. And at an external and social level, it reflects, for instance, by encouraging social interaction, relationships, community, sharing this inter-health spirit. And I have just another example to share with you, that one person said, the biggest pleasure is at the end of the event, when people come to see you to tell you that it was that they had a great time, that it did good to them. There is a whole lexicon of feeling happiness, and this is the big reward. Another said, well, this revitalized the neighborhood spirit and nurtured the social relations we had. We were invisible, and through this activity, we were heard. It was as if part of my story was being represented there in the performance, a part of our story. And this was a case study based on a community engaged artistic project. On the third level, it was the contextual and political level. If you might remember, we, for instance, reflect on resistance to lockdown, to authority, to social norms, idea of freedom, autonomy, but also strengthening territorial assets and identity, and external recognition and interest. Just to have you another voice, another person said, we are also getting into something more political since the ban of the gatherings, and this was during the COVID. We can't live for years and years without taking any risk, so we choose to live with the risk, and therefore to restart this vital space because it's necessary. We have a role to play. This was with organization of events, of musical events, and it gives me hope, as it is to compensate the lack of relationship, of sharing space. I see that we have succeeded in creating this, a space for artists to express themselves. Open, hope is reborn. And just the last one on this level, this another person that this workshop is very important to give value to our land, because in the past there were a lot of artisans here in Roulette. It was a city where the activity took place. There was coppersmithing, potters, shoemakers. It was everything. We did everything. Now everything is lost. There's nothing. Here, the coppersmithing had already died. The man who was here had died 7 or 8 years ago, and there was no one else to carry on. If I didn't come here, this art wouldn't exist anymore. So it has several layers to show you this. So these are some examples that illustrate the complexity of the framework of attributing value to participation in art and culture. And thus this interplay and interconnection of these dimensions, they need to be considered when connecting arts, culture, and health and well-being. Giving attention to how people qualify their participation in arts and culture and the impact it has in their lives. It's key to have a comprehensive view of the strengths and roles, the roles that arts and culture can play in health and well-being. And just very quickly, I come to the second point, that is to stimulate qualitative research. So in the project, qualitative research techniques, as I mentioned, was the focus. It allows us to understand the valuation of cultural participation by attachment, gestures, attitudes, through narratives, informal conversations and between the participants, for instance, and also emotional manifestations with non-verbal expression. So among others, this allowed us to reach to some of unexpected outcomes, such, for instance, in one hand, the sociability of being together had a high meaning during the COVID pandemic. And this had make us unexpected outcome, that is the tension between health and well-being during the COVID restrictions. So
excuse me, can I just intervene for a second?
Yeah.
just for the sake of timing and then still allowing participants to pose their questions, could you try to be
Yes.
succinct? It's super interesting, but just for
Yes.
for the sake of the debate. Thank you.
For sure, yes, thank you. So just to go and with this idea, stimulate qualitative research. Okay, so there was the evaluation practices of participants in arts and culture is organic, it's fluid and dynamic. So it's based on qualification. So we believe that qualitative and contextualized research can reveal these unexpected and unplanned outcomes of cultural participation, being important to inform cultural planning of the wide range of benefits for individuals and communities in terms of well-being, resulting from the participation in cultural activities. So in addition, well-being and health is a complex concept. So it is important to develop research initiatives to build up deeper and ongoing knowledge about the value of art for individual and collective well-being, and to understand how the relation between culture and well-being should be calibrated and the effects should be prioritized. So, and to finish, this relates with my third last point, there is to promote participatory policy framework process. So the data collected, it showed us that the pluralities of values expressed by social groups, including contents and context, that values are not abstractions. So they are linked to concrete experience in practical situation. So given the plurality of values that participants attribute to their own cultural consumption and participation, and the different actors involved in cultural participation in general, but also in particular related to evaluation process of well-being, it was investigation to investigate further to promote participatory approaches, namely encourage ongoing involvement of different actors within the cultural sector in the development of policies for well-being at regional or local level for connection and contextualization, for instance, promoting design or personalization, monitoring of all these relevant policies, to facilitate multi-level governance and intersectoral dialogue to empower these different actors of cultural sector, as mentioned by Arturo, being involved all the cultural sphere, to participate and inform in an active manner for political decision-making process. And last, to activate local cultural resources and make possible for people to engage with arts and creativity, activate arts and culture tools. So I'm finishing here, and we can discuss then later on. Thank you.
Thank you very much. That was very interesting, and I'm sure your presentation, as well as the one of before, have resulted in some questions. So I'm now handing over to my colleague Beatrice, who is handling the Q&A. After the Q&A, you will have a very short break before continuing with the next session. So Beatrice.
Thank you very much, Christine. Good morning to all. I will turn to Matej, please, to show the questions that have arrived through Slido. If there is no question immediately available, then I would like to ask from the stakeholders, do you know any similar large-scale initiative that is using arts and cultural activities for well-being and mental health? Would you like to point us in the direction of a similar initiative? But you have to use Slido. We see the questions. Very good. Thank you, Matej. Okay. Yes. So let's maybe start with the second one, how to make sure we capture the community impact of cultural participation. Studies often measure the effects on individuals in social contexts. I see we're really going at the heart of the matter, so the robustness and replicability that was mentioned before. I'm looking at the speakers of the 3 projects. Would you like to answer this question and take the floor? Francesco, would you like to intervene here?
If nobody dares, I would break the silence.
Go ahead.
By saying that this is exactly the challenge. It's a wonderful example of how much we need to improve on the evaluation side, on the assessment side, on defining indicators and metrics for this that I might call a scalability process from the individual effects to the community effects. There are at the moment only narratives and descriptions of these effects, but the protocols I was invoking before should exactly be aimed at filling in this vacuum, which should also reconciled with the individual experiences and also with the framework, which is also a regulatory and policy framework to be considered.
Thank you, Francesco. Would the representative from Invent also say something about this question?
Yes, I think it's a very good point. And of course, there are also studies which capture at a more aggregated level both the infrastructures for cultural participation on the one hand and the use of these infrastructures, and on the other hand also health inequalities in different parts of cities, for instance, or across different cities in a country, etc. So I think it would be nice and useful to indeed link these type of more aggregated studies to the individual level studies. And that's indeed a challenge, but an important step to take.
Yeah. Thank you very much, Professor Janssen.
One little thing.
I'm sorry, somebody's talking?
Yes,
From
sorry.
the Uncharted project, maybe?
I just wanted to add one thing. I think what we also should not forget that the community can also be sometimes in bigger cities, there can be neighborhoods which have very different people living there. So one of the things that we also find in the research is to also look at for who we cater. So poor neighborhoods where, for instance, hip hop culture is important, then it doesn't make a lot of sense to then foster cultural participation for going to the theater. So these kind of things should also be looked at if we look at the community. What is the community? And I think that indeed needs more attention in research.
Thank you very much, Professor Verjoor. Uncharted, would you like also to say something briefly about this question?
Yes, from our perspective, this is crucial, certainly, to go farther than the individual perspective on the connection between culture and well-being. And how to do it? Well, there are well-defined and long time used qualitative research techniques for that. There are community studies of different kinds. I would say, instead of going into details of how to do it in particular, I would say that what this means especially is the importance of the processual perspective, because these impacts on at the community level involve, and it is fundamental to understand the process through which a community can be transformed to some extent. We, for example, in the project study processes of culture-led urban regeneration, specific processes, and that is fundamental. So it is something important to add to the most standard perspective of taking pictures of the situation and taking just impacts on individuals.
Thank you very much. I have an anonymous whom I would like to thank for giving us an example of what happens in Ireland. Thank you for that. We will certainly Google it if we can quickly to include it in our good practices. I would also like to answer to the second anonymous who is asking, is it possible to access Professor Janssen's study? That on the portal called Cordis, C-O-R-D-I-S, you will find already basic elements of each and every EU-funded project through the framework program, and access also their published, publicly available results. If you were looking for something else, please write to us, drop us an email, and we will try to be the go-between with yourself and the project. The other question I like very much, but the answer should really be very short for the sake of time, is we're speaking here about the well-being of individuals and populations and what can arts and cultural activities can do. But we should not neglect the long-term well-being of the cultural workers likewise. So the question is, how can we ensure the long-term well-being of cultural workers too? Anybody who would like to answer this question from the 3 projects of session 1?
As far as MESOC is concerned, the experience of and the benefits of the experience of cultural production extends itself to the producers of culture. So I don't want to be negative, but it's something we want to highlight as a very important component of the cultural activity, the reward it gives to the people themselves. So there should be no major difference methodologically wise between the measurement of the 2 experiences, although keeping this distinction into account is always good for research design. Thank you.
Thank you. Maybe Uncharted, you would like to answer.
If I may add something with respect to this point, I would like to say that from Uncharted, from the start, in the definition of the project, this is also crucial. There are it is not only the space of the publics, of the people attending cultural activities that is important, that it is particular and very significant the way in which this works at the level of in the areas of cultural production and heritage management, also at the level of cultural administration. And all of them, these 3 areas are connected and influence each other at the same time. The way to look into that is, first of all, to develop an approach that really focus on these specificities of these areas. And sometimes this is not the case, and in my view, it would be very important to acknowledge this complexity, structural complexity of the topic, and to look also on that specific areas.
Thank you very much. And from Invent, any feedback on this issue?
Yes, I think it's a very important question and an important point to look into. It would be very cynical, of course, if we are talking about how culture can contribute to the well-being of all segments of the population and not care about the health of the people who actually providing these cultural offerings and doing these cultural interventions, etc. So, and we know from a rich strand of literature that indeed the conditions of many cultural workers are precarious. So this is something which still needs a lot of attention and yeah, a lot of, I guess also a lot of support from policies at the local, national, European level to ensure these working conditions, that these improve. So that would be my take on this. Yeah.
Thank you very much. I would also like to thank the anonymous contributor informing on other initiatives. We know that initiative, but it's good that this is shared with a larger audience of stakeholders. Looking at the watch is 5 minutes after 11. I would say that maybe we could conclude here. We will keep the questions that were not answered in Slido, and we will make good use of them. I think we will discuss how to do this, but don't worry, because this is very valuable material for us. I would like to either give the floor back to Christine for closing the session. If not, I can do that as well. Christine, are you still here? Doesn't seem to be the case, so we would like really to thank you for participating so actively. The first 3 projects have already shed a lot of light on well-being and the broader concept of culture and the impact it has on the well-being of individuals and societies. We will now, if you agree, come back at 11:15, so a very short break. And let us be prepared to hear from the other 3 projects, and our moderator will be our Deputy Head of Unit, Mina Stareva. So, see you at 11:15. Meanwhile, I'm announcing another question in Slido. It's just an icebreaker which makes us understand who is there from the stakeholders. And I thank you if you can take a few seconds to answer it. Before we start at 11:15, there is a second Slido question still in that spirit of breaking the ice, although I think the ice is already broken. I see smiley faces, so I thank you. See you after the short break. Thank you very much.
Hello, good morning. Good morning to everyone. It is 11:15 and I suggest that we resume the workshop of today with the second session on the agenda, which is the session on research results on culture and arts with regards to well-being, mental health and loneliness and inclusion for all. My name is Mina Starova. I'm the Deputy Head of Unit of the Unit Fair Societies and Cultural Heritage in DG Research, which is actually representing all the unit in DG Research Innovation, which is behind the policy work on promoting and emphasizing the impact of the arts and culture for well-being. Together with my colleagues here, Beatrice Lucaroni, Nora Eronen, and Pilar Gonzalez. It is also the unit which is in charge of stimulating a research agenda on culture, arts, and creativity for mental health. And hence, I'm very pleased to welcome you to this second session and to see that you are a high number of you being represented here this morning. So the session will actually feature research results of 3 projects which were funded under Horizon 2020, where each of the speakers has been invited to reflect on 4 elements, namely to present good examples of arts and culture for well-being, mental health and inclusion, which can be replicated, upscaled and disseminated. Present us also some good practices developed under the project, the methods that were used to measure the impacts of arts and culture for well-being, and of course to share with us reflection on the future avenues and needs in the field. Just to remind you, you, the participants, you are all invited to share your questions, feedback via Slido. So my colleague Matei will show the Slido QR code on your screen. So you can share your feedback during the presentations ahead of the final session on question and answers, which will be moderated by my colleague Beatrice. With this, I think that it is about time to actually give the floor to our speakers at this morning's session. So let us start by the project AMAS, which is Acting on the Margins, Arts as Social Sculpture. And I'm very, very happy to invite Professor Satu Miteden from the University of Lapland.
It's my pleasure to be sharing also the outcomes of AMAS project for the consortium and all the researchers and artists participating in this initiative. Should I just go ahead? So sorry, or interrupted I? No, okay.
Please go ahead. Indeed, the floor is yours.
Yes, okay. So our project's ambition was to contribute to experimentation and methodological development as well as implementation of policy processes in the socially engaged art. And I think our project has been addressing a lot of the issues already discussed in the morning. We were addressing 5 specific objectives: developing multidisciplinary methods based for measuring social impacts of the arts, reducing isolation of minority groups, educating through various philosophies of participating, and developing and evaluating policy frameworks to overcome some of the major challenges in arts. And then we were also focusing on decolonizing some of the structures and processes around arts and minorities. For us, we created a number of pilots and experiments. We created 36 pilots that we utilized to create European testbed and evaluate the impact of the arts. We were working quite a lot with policymakers, arts and cultural organizations, and also, of course, individual stakeholders. We engaged 288 policymakers in our policy work and building roadmaps and so on. And then we were also engaging the policy makers and external stakeholders again to encourage them adopting our policy recommendations and roadmaps, and that was 195 policymakers. Our dissemination was quite wide. During the project, we were, for example, able to make 9 open access books and monographs. I think altogether our publication amount for high-level peer-reviewed research papers, books and journals was more than 70, which is quite high. We were addressing societal challenges such as various forms of exclusion and poverty, cultural poverty through lack of cultural capital, material, educational and skills poverty as well as poor networks. We were trying to promote resilience and inclusion in European regions. And we were working, we did a lot of inclusion work with peripheral communities. And we were working also through art-based methods and service design with number of vulnerable groups. We worked with people with disabilities, elderly people, persons living with HIV, adults with intellectual disabilities, students with learning difficulties and HDAD, deaf people, people with special needs, marginalized youth, immigrant communities, indigenous Samiku children, Roma minorities and sub-Saharan migrants. So our project focus was definitely to look at marginalization and the impact of arts in addressing this and try to measure this. So this was what we started with. We wanted to be very clear in the state of the art and mapping out what is characterizing at the moment the social impact of the arts. And we did systematic literature review to address this. Our number of articles was 10,227. So we did quite extensive systematic literature review to map out what is already known about social impact of the arts. And when we were outcomes of this first systematic literature review, of course, it told us that, there's a challenge in measuring the impact, but it also told that there's a lot of work done, especially with children, with theater, drama, with schools, different kind of communities. Of course, one cluster was around culture and museums, history. So you could maybe cluster that there's 3 big clusters, one around culture, museum, history, this kind of keywords, other one around theater, use of theater methods and techniques, and one around different kind of art communities, school, teaching and learning. And then we jumped in deeper there that, okay, this is what has been done. And of course, the systematic literature review showed us that the social impact of the art, including topics, the amount has been exponentially growing. If you compare 1990s to 2020, you can see that the increase is huge. When we wanted to know more exactly that what has been then done, what kind of art-based interventions for addressing marginalization in European context, what is there, what is characterized now, what kind of actions are done. We did more thematic literature review, looking at we went through 230 34 abstracts looking at what they are saying. And outcomes of this can be categorized in 3 actions: creating opportunities for personal agency, empowering the expression of identities and experiences, fostering learning and development. So these are the main areas which are addressing how artistic means are used for social change. When you look at the work done, artistic practice is understood as a product of specific local, historical, and socio-cultural context which can either uplift, sometimes it can also obscure marginalized communities. And social effects of the art presented in this corpus, eliciting media response and influencing structures of power through public discussion, building indigenous and community identities as a way resisting hegemonic cultures. Participation in art increases critical awareness among marginalized groups and has an effect on proactive approaches to stigmatized health concerns within the medical community. Based on this systematic literature review as well as thematic literature review, we started building a European testbed, and we created 37 experiments on this testbed around social impacts of the arts. We created a methodology around pre- and post-assessment surveys, demonstrating that participants had high expectations, highly positive experiences of participation. Testbed fed into local, regional, and European-wide policy recommendations from which European AMAS policy paper was developed. We also engaged a lot of policymakers throughout the way to make aware of advantages of social engaged art. We were encouraging them to promote social inclusion, cultural access, and wider participation of all members of society. In our testbed, it was built around University of Malta, University of Lapland, Corvinus University, Budapest, Charles University, Prague, Paco Design Collaborative in Italy, APEQUE in Portugal, and University of Leeds. And all of us, we created 5 experiments that were evaluated with complex mixed methods approach. We used both in pre-testing, of course, it was based on this systematic literature review, and then quantitative, qualitative data collection and the quantitative data analysis. We were looking at this both descriptive and inferential analysis. And to do studies on this testbed, it meant integration of qualitative, quantitative data, and trying to analyze, understand the impacts through triangulation, using also data visualization. And we in the post-test, to understand, okay, what was the impact, what happened, we also used this quantitative, qualitative data collection and thematic analysis and data integration. So it was quite a huge, how do you say, like huge body of work that we put through our testbed. Of course, the testbed and methodology is there, so we hope to use this further also to do more research work on the testbed. Out of this body of data, we developed AMAS policy white paper. Also, we created regional policy roadmaps in 7 European regions. What is the role of arts in mitigating societal challenges? And in the white paper, we created suggestions for stakeholders and policymakers based on findings of the project. These are all, you can all see these on our AMAS project website. And of course, we hope that you will look at these and of course compare and see how they relate to all the other projects and experiments now done in other projects. And what we are then recommending, we recommend documenting all art-based activities, expenditures to provide strategic guidelines for further projects, to build on what you already know. We hope that you will be incorporating well-established institutions to act as mentors. It is really important that we use the knowledge already gathered and share it with others who are coming into the field. Aligning funding issues and opportunities with community needs, that makes the most impact, that you will be working to first understanding what are the needs and then responding to these and aligning these fundings to make greater impact. Creating impact measurement tools for mixed method approaches and evaluations. We will definitely continue our methodological development, and we have of course already shared a number of research papers, but we will continue this work. And I think this is the key, that there needs to be more and more of these kind of measurement tools developed and utilized. The more we do this, the more we learn. Promoting dialogue across sectors to harmonize approaches to participatory arts. Maybe not everyone inventing the wheel dozen of times, but here again, learning about others. Encouraging experimentation to increase access and participation of marginalized groups. I think this is the idea, to be agile, innovative, and implement is really important. In the project, we have also launched MOOC, massive online learning course, which is free for anyone, where we are giving an introduction to socially engaged art, diverse approaches for mitigating social challenges through art-based initiatives. So there is a body of learning for everyone. This can be integrated in both in education sector as part of curriculums and courses, but this can be also utilized by policymakers or informal sector as a learning how to work with socially engaged art and how to maximize the impacts. So we have created a significant body of work that is, I think it is vital to the area of social exclusion and arts participation. Also, as an outcome, I could say that it clears the way to a more evidence-based approach to arts and inclusion, with a joint up approach to service design, empirics, and policy. It emphasizes the importance of inclusive, process-oriented approaches to participation and demonstrates this number of levels: foundational literatures, case studies, and policy recommendations. Okay, thank you. This was my speech.
Thank you very much, Professor Mittinen, for this, I would say, very impressive and insightful presentations. Thank you for sharing your work also on developing a comprehensive framework for evaluating arts-based social interventions. The example of the EU test bed around the social dimension of arts was very, very insightful. So thank you very much for this. Without further ado, I would like to pass the floor to our next speaker in this session, representing the project ARTIS, Art and Research on Transformations of Individuals and Societies. That would be Matthew Pelowski, Assistant Professor at Vienna University. Professor Pelowski, the floor is yours.
Hello, can you hear me all right?
Yes.
Good. I'd like to first of all thank everyone for sticking around for this very important chance to share some of the work we've been doing. And I'm very honored to be here. As was mentioned, I'm Matthew Pawlowski. I'm the coordinator of the Artist Project. It's a 5-year project we started in 2020, and it was answering a call in the H2020 Transformations Societal Challenges in the Arts call. And just to give you a brief idea of where we're coming from and what we're trying to accomplish, especially as this pertains to health, well-being, and to some extent inclusiveness. Our initial focus of the project was to speak to, I think, one very important aspect of well-being, but one that is within the broader conversation, especially given some of the dialogue today, which is art's ability to change attitudes and behavior. So essentially we were looking at the large number of exhibitions, installations, curatorial practice, museum practice, as well as arts festivals and funding on various levels that had found an interest in taking the arts or employing the arts as a vehicle to speak to climate change. Can visiting an exhibition change your attitudes about the global health of the earth? Can it speak to inequalities? Can it raise awareness about migration or the plight of refugees? Can it speak to social justice? And essentially we were answering the mandate in our consortium of some very basic questions. So essentially, can art be used for this? To what extent is art actually a good vehicle for doing this? How do we do it? And can we do it better? And I would also like to mention that as the project has progressed over the 3 years that we've been doing this so far, spurred, I think, initially by the global pandemic, but also some very exciting developments across the field of arts and health and well-being. We've also shifted with the times and adapted more and more of our focus in parallel to also looking at this idea of, can the arts be put towards mental health and psychological well-being? Can a visit, say, to a museum or looking at a painting change your levels of stress? Can it make you feel less anxious? Can it improve your mood? And can it make you feel even less lonely? And I think our consortium is in a particularly interesting and unique position to speak to this, because our answer to both of these, what I would consider parallel challenges, and I would also say that I'm happy that this has come up again and again, and as a point with some of the previous speakers, is before policy and before application, we need evidence. I think it's extremely exciting to see all of these developments and all of these things being tried and all of these projects emerging to really bring the arts to people and to target well-being. I would also mention, for example, the development of social prescribing. But I also fundamentally feel that to really move forward, we need to move from just doing and trying to understanding and looking into the what is really happening in these art experiences. If we can find, the sort of effects we want to find, when, for whom, how. And I think even today, there's surprisingly little data on this. Most of the work that has been done to date is either anecdotal, as was already mentioned, or epidemiological, but we need to bring in the empirical. And even more than just getting empirical data, we need systematic approaches. We need to develop ways of assessing how people are engaging the arts, what could be the impacts. And we also need to come up with measured ways of detecting, but also controlling for the sort of outcomes we might want to find, to be sure that what we're finding can actually be attributed to, say, something about the art experience or something about an artwork and not just some other factor. And we also need theoretically driven approaches that really take into account the nuance of art experience. I think it's quite easy to jump to just finding something beautiful or just having a pleasurable experience, but we really need approaches that can anticipate the very rich mix of ways of responding or looking and feeling and thinking about your body that might inform the sort of outcomes we would want to find. And I think this also needs to be multidisciplinary. And then only then, once we start to establish this basis of understanding art experiences, then can we start talking about policy, limitations, comparisons, or better applications. And I would just note that I think the same argument is also being made in the discussion of mental well-being as well, where there's a lot of argument for the need to get data, but even more to move on to discussion of mechanisms or ingredients that might be driving some of these effects. So essentially that's what we've been doing. We involve 9 partners, and it's a blend of art institutions, experts in art history, in philosophy, as well as in policy. We have as a member the UNESCO Chair of Cultural Policy Management in Belgrade. But also at the core of this project, we have several laboratories and institutions across Europe that had been for many years investigating art experiences, mostly from a psychological or a neuroscientific perspective. And this project has really given us an amazing opportunity to come together, to work together, to share methods, to think about ways to apply them to different cases. And for the past 3 years, we've essentially been on the ground conducting studies across Europe. The point of departure for the study is to, or for the project is to really go to where the art is right now. So we've been working in museums, in galleries. I think to date we've done on-site work in over 20 art institutions, including, for example, the Venice Biennale, the Documenta 15, but also free street-level galleries. We also look at the city, so murals in the city, art in the urban spaces, and also in the home to some extent. To date, we've assessed over 10,000 participants' art experiences, representing over 35 countries. And really the basic unit for everything we're doing is to look at these individual meetings of one person and one artwork and one individual experience as a way of saying, okay, if we can understand what's going on there and what the outcomes might be and what's happening, then we can use this as a building block to talk about application or chaining different experiences together or prescribing, for example. And I would just mention that we're about 2/3 complete with the project. We have about 2 years left, or 1.5 years. And really, we're just wrapping up some of the empirical aspects, and the next steps are to move this into policy and also into some co-creation with artists. So just to give you an idea of some of the, I think, top-line findings of the project, and I've selected some things that hopefully can speak to some of the topics for today, is first of all, we find that art experience can be assessed. And I think for many of our members, that wasn't surprising, but it's good to see it consistently be verified. So how we approach art experiences is we actually use a blend of measures. We often use, say, a pre-post design and survey where we might ask someone to self-report on how they're feeling or attitudes they might have to a certain topic, and then have them have an visit an artwork or visit an exhibition, and then test them again downstream to see if we can find changes and also how they reflect back on their experience. This is also mixed with a blend of physiology, mobile eye tracking, phenomenological interview, even brain responses, and also some work that was mentioned earlier by one of the other speakers to use, say, methods on your phone so people can report daily how they felt that day, and then maybe embedding an art experience somewhere in the middle of their life. We also have started developing RCTs, or randomized controlled trials, which I think is really where we want to get to eventually. And one of the exciting things we're finding is there is evidence for impacts. It does seem to be consistently that we do find the sort of effects we might like to find. So at the level of mental well-being, mood, anxiety, we've found, for example, that a visit to a museum can make you feel better. It can make you feel less anxious or to report less stress. And we've tracked this in multiple museums, for example, the National Gallery in London, small museums in Austria, but also seen a mural in the city. Maybe even more exciting, this works with one work of art. So we've done several studies where we would just have someone visit one artwork, say like one Monet painting, which is over my shoulder, and we find the same effects. It also works with only a few moments. So one of the consistent findings is that if someone spends a minute to 3 minutes with a work of art, we do find significant changes in their mood, their anxiety, even loneliness. It also works online. So one of the projects we've done is to send people to Google Arts and Culture and say, see one exhibition on one work of art. And we find, at least at the level of mental well-being, that it has many of the same effects. And I think when we start talking about replication, scaling, bringing this to many people, this is really exciting. We've also found exciting evidence about mechanisms. So for example, looking at the desire to have art make you feel better, we find that it's not enough just to put someone in front of an artwork that is beautiful or that they even like, but it's very important that they report their experience as meaningful, and it has to be meaningful to them. And I think when we start talking about even aspects of inclusion, this is very important. We also do find that art can change minds. So across Europe, again, we've done several studies where we would work with, say, an exhibition about refugees and find that, yeah, when people are done, they report on some standardized measures that they're less xenophobic or they're more reflective. When they visit an exhibition about the climate or climate change, they report being more aware of that and thinking more about the relationship to the earth. This also works with some measures that are getting beyond just survey or just self-report. So for example, we found consistently that visiting an exhibition would make people more likely to donate to a cause if they're given an opportunity. One of the other aspects of the project that we found is speaking to this idea of universality, as well as nuance, but I think also inclusion and future applications. So one of the projects that I'm most excited about is work we've been doing for several years to collect thousands and thousands of people's individual experiences with one work of art, with a wide range of artworks, which are hopefully sort of speaking to the different types of art we might encounter, say if you go to a museum. And we asked people to report on the experience they've had using a standardized list of different feelings. So for example, I felt anger, I felt awe, I felt harmony. And by taking all of these experiences, we can use some big data modeling approaches to really make a map of what art experience might feel like, but even more, we can tease out certain patterns that represent shared ways of responding to artwork. And what's really exciting about this is it gives indications of shared experiences below the level of who and what you're looking at and where you are, and really speaks to these universal responses we might have, which of course we can build on top of. But one of the exciting findings is that the type of experience you're having really does lead to the sort of outcomes that we're looking for. So one of the things we've been doing is asking people, did this art experience make you feel better, or did this experience make you a better person? And we find that it's probably very unlikely that you'll get an answer to both of those at the same time. But having someone have a transformative experience that changes their mind and makes them develop as a person might make them feel worse for a while. And so we can really start talking about what sort of outcomes we're seeking. And then I would just end to say we also have really interesting data about limitations. And this is one of the things we're trying to move towards now. So instead of just doing a pre-post immediately after you visit an exhibition and saying, how do you feel now? We've done some approaches with EMA, or ecological and momentary assessment, where we might track people for 3 weeks and ask them somewhere in the middle to go visit an exhibition. And we want to see how long do some of these effects last. And actually one of the findings is that if you say send someone to an exhibition about refugees and you ask them about xenophobia, we find that for the rest of that day, they might report being more reflective. They might say that I tried to be more pro-social to other people. I thought of other people, but by the next day, it's more or less gone. And for mood, it's maybe much shorter. And I think that, I'm just at the time, so that leads to just 2 points that I want to end with, especially thinking of policy or where we go from here. One is, again, I would like to advocate that we do need evidence. And when we're thinking of doing projects and calls, I would really strongly advocate that empirical evidence and systematic approaches need to be a basis for everything we're doing. Just to take the example of the very fleeting impact that art might have on attitudes and mood, you could be cynical and you could say like, well, it's a bit disappointing that you only feel better for a few minutes or that you're only a more reflective person for a day. But we could also start saying like, well, if we multiply that by the thousands of people who might see this artwork, or every time we come across an artwork, we do have this blip of better feelings for that day. That might be enough, but I would say we can only really start to have those conversations if we have hard data to build on. And finally, just to very briefly note inclusion. Of course, this project was really built on the institution and the art as it's present right now and who's engaging it. To some extent, I think it's exciting that we do find universal responses and the sort of impacts we might like to have are available to everyone. But of course, the topic also is, or it's very important to be mindful that who is having the opportunity to visit this art and to engage it. And I think we need to think about that going forward. Thank you.
Thank you very much, Professor Pelowski, for this very inspirational, I would say, intervention. Thank you for bringing also the ability of arts to change behaviors and attitudes. This is also very important and fully in line also with the work that we do in our unit. But also to mention the development of social prescription practices across member states. Indeed. So your appeal was very clear. So there is a need for empirical evidence and systematic approach. Also theoretically driven approach to develop effective policies. And this is also the objective of today. Thank you very much for sharing all your great practices within the project. Now I would like to give the floor to our third speaker in this session to present the point of view from the perspective of Traction projects, opera co-creation for social transformations. Miquel Soria, director of Vicomtech. So Mr. Zoria, the floor is yours. And of course, my colleague Matej is reminding us that please, participants, do share your feedback, expertise, but also questions that you would like the speakers to address within the session of questions and answers, which will follow immediately after this third and last intervention in this morning.
Hello, good morning. First of all, many thanks for your invitation and to this very interesting workshop. My name is Miquel Zorrilla. I'm the head of digital media and communications at Vicomtech, and Vicomtech is a research institute, an applied research institute located in the north of Spain. And I've been the coordinator of the Traction project that ended at the very end of 2022. So to start, I would like to share a video. It is 2 minutes long, and I think it reflects very well what we did in Traction, and I think it's the best way to visually show what we did in the project. So I will share the screen and the video.
Traction was a partnership of opera companies, research institutes, and universities established to explore how opera might tell new stories in new ways that resonate with today's European societies. The foundation of our work was co-creation, a process in which professional artists work on an equal basis with non-professional artists to create new art. Traction facilitated the co-creation with digital tools it developed and adapted. That's what happened when one of our partners, the Liceu Opera House in Barcelona, worked with people from Raval to co-create a new opera about their dynamic, diverse, but often misjudged neighborhood.
La jugada perfecta.
In Portugal, the SAMP Music School has been producing Mozart with inmates of Leiria Youth Prison for several years. But Traction gave them the chance, the resources, and the technology to co-create a new opera rooted in the lives of the participants and their relatives. Irish National Opera's project was original in a different way. It is the first virtual reality opera co-created by professional and non-professional artists. Traction's technology helped connect remote communities who could not work face-to-face during the COVID-19 pandemic. We have not found the Holy Grail or El Dorado. Opera still faces many questions and challenges if it is to matter in the 21st century. But we have shown that through co-creation, this demanding and glorious art can open itself to the world. Find out more about the opera's co-creation and Traction by visiting our new website, co-art.eu.
Okay, so I hope that you enjoyed the video and you had no problems with the audio and so on. So I would like to talk about what was our motivation to do Traction, because Traction born with the willing to answer a lot of different questions. Also questions regarding the social value. Like, for example, has participation in opera co-creation extended the capabilities of the participants to do and to be what they want to choose? And through co-creation, our hypothesis was that the collaboration between professionals and non-professional artists, we could discover in opera new ideas, new stories, new formats, new performers, and ultimately new advocates to opera. Through opening the doors to the studios, to the auditorium, opera houses can transform their offer to the public and the relation they have with the society and with the communities. So very briefly, and with this motivation, I would like to explain Traction in numbers, even though we saw already the video. So we did 3 new opera co-creations, so 3 new community operas with more than 1,300 non-professional artists and community members participating in singing, poster designing, construction, composition of music, VR animation, storytelling, photography, printing, costume making, etc., starting from teenagers to retired people. And we had more than 8,000 audience members at live opera performances in 11 different opera performances, and more than 766,000 people watching this co-creation of opera performances on TV and online. We were a multidisciplinary team of more than 30 researchers following the process and guiding Traction, and we created 2 new digital tools because we thought technology was completely key in this co-creation process to help or to support the co-creation process and the performances with more than 20,000 user interactions across the different tools. So today I would like to focus on what we learned doing this project. And I structured this talk in 3 different pillars. First of all, what we propose the guiding principles for co-creation are, because we thought a lot about this and we don't want to be prescriptive, but we would like to be helpful to open the floor to others that they are interested in co-creation in opera and in co-creation in performing arts in general. Also, the second pillar about the technology, because we believe it is completely key and crucial. And finally, some suggestions or policy recommendations that we found interesting or relevant after our research in Traction. So I will start with the first of these pillars, which is the guiding principles for co-creation. So opera, as other cultures, as culture as a whole, is changing a lot. And if culture must always, if it wants to remain, it must be creative to stay alive. So we produced a book Here I have a physical copy of the book, which is Co-Creating Opera, Guidance from the Traction Project. But if you go to co-art.eu, the website, you will find everything about what we did, but also a digital copy of this book, the Guiding Principles, where we discuss about 7 guiding principles, thinking on the professional artists that they would like to do co-creation. And I'm not going to focus in all of them because I think it's better for you to research a bit and to read it and so on. But it takes things like you need to be ambitious because we believe that co-creation can be artistically as exciting and socially very transformative as opera ever hoped to be. And its productions are different because we have different voices and different ways of expressing themselves, but aspiring to be equally in very high standards and being excellent in terms of artistically. You also need to be take into account to be equal because you need to manage the power between professionals and non-professionals, and co-creation means sharing the power. You need to be open because the co-creation process will end in ways that you maybe did not consider at the very beginning. So you need to be very generous to manage the expectations of professionals and non-professionals, and take into account that you need to handle with this equality. And of course, and among others, you need to be responsive, you need to be patient because it takes time to build trust between communities, between professionals, to really connect with the people. And you need to be hopeful because this is a process that the process itself gives fruits, but also the final co-creation performances and the artistic work also is something very relevant. So again, with these guiding principles for co-creation, I really encourage you to go to co-art.eu website and to download the digital version of the guiding principles from the Traction project. As I said, going on or moving on to the second pillar, we believe that the digital revolution is playing a crucial role in general in society, but also in performing arts, in opera, and the role that technology could have in co-creation is completely key for new ways of telling stories, performing together remotely, and allowing novel formats, and so on. So we developed 2 different tools, among others, but mainly 2 different tools. The co-creation space, which is a kind of a private social network, but very focused to promote a discussion and a collaboration during the co-creation process. So, for example, the different choir members, amateurs, and professionals that participated in the operas could rehearse and exchange information. For example, teams involved in the visual poster design of the different operas could also work together with images, with videos, and so on to create something together. So that was one of the tools. And the other was the co-creation stage tool, which is a digital tool to enable distributed performances from different locations. So, for example, as you saw in the video, we worked with inmates in the Leiria jail prison, and they were like 14 inmates that were participating in the project. And in other years before Traction, they all participated during the rehearsals and the preparation, but then on the moment of the performance, only a few of them were able to go out from the prison to the main stage and be performing with the orchestra and the professional singers and so on. And it was very frustrating for the others. So with this, we connected different stages, the main stage in Lisbon and a secondary stage in the prison of Leiria, and also other families and houses around the world. So the inmates could sing together from different locations or could sing in real time to their families, mothers, relatives, and so on. So it was very empowering to see how the technology was really solving a problem. And here again, if you go to the website, co-art.eu, you will see a specific section about technology, videos about the point of view of end users using the technology and how it was solving problems, and also a technical wiki where you can see all the open source tools that we did and are available and useful for all the community. And finally, and to finalize my talk, I would like to focus on what our experience in Traction suggested to us, or what we believe are good recommendations to support the change and to support the role of co-creation in art. And specifically for policymakers, we believe that it is necessary to make the right to freely participate in the cultural life of the community the foundation of the cultural policy. So expecting that citizens' participation will be active and creative. And we would like also to emphasize that we believe it is important to put co-creation at the heart of this cultural policy, expecting that the recipients of public cultural funds will develop their own approaches to work creatively with their communities and to have their voices, their view, and to make really a significant and meaningful artistic piece for all the society. And we believe also that it is very important to promote and develop a technological open ecosystem that will facilitate, that will foster this co-creation process, enabling diverse people to create and perform together. We produce also, and you will find in the website, a policy paper. Of course, we have the deliverables with more detail and so on, but we try to produce a brief and meaningful policy paper, which is also available digitally in the website. And here you have more more development of what we believe are the policy recommendations. But I would like to end my talk saying that Traction redefine the purpose of the cultural policy as being to strengthen the human capabilities. We really believe in the capabilities approach of the human and the message they want to really give and to add to the art that is important, because we believe that expecting that citizens themselves are the best place to choose the cultural experience they really need. So that's our vision about the co-creation, the relevance, and how technology can help this co-creation of really listening to all the voices and making all participants of the art and the culture. So thank you very much for your invitation, and I hope it was comprehensive.
Thank you very much, Miquel Soria, for this excellent presentation. Indeed, it was very, very interesting. Thank you very much for sharing and emphasizing the transformative power of community engagement, involvement, and also for presenting the guiding principles that you have created for co-creation, the vision you have for co-creation, and of course, the digital tools that you have developed. All of this is, of course, very, very useful for us. And I'm really looking forward to receiving the feedback and the questions from the participants. And for this part of the agenda, I'm handing over to my colleague Beatrice so that she guides you to the questions that we have received. Beatrice.
Thank you, Mina, and thank you very much to the three speakers. So, like we did this morning in session number 1, let's continue and see the questions that we have received. I think up front we can say that there is a very short question for artists. So the question is, to increase the duration of impact, would it be more likely to have enduring impact if art was brought, I imagine, placed in people's workplaces? Short feedback from Matthew?
Actually, that's one of the things we're trying right now. So I think some of the results we have leave very much open the potential of this cumulative, additive impact of art, or living with art for a while. And I'll just say that we're running studies right now where we've worked with some partners to say rent an artwork and install it in someone's home or install it in an office. Again, there's a lot of exciting things being tried there, and I think there's a lot of anecdotal reports that it works. And now the next step is to matching that with some empirical data that's a bit systematically collected. So yeah, I concur.
Thank you.
Yeah.
Another question is, how do you make sure that the results you obtain are robust enough and really universal? I think this is a question for the three projects. So first one, who would like to give a succinct answer, please?
Okay, maybe I can start from the traction perspective. Well, this was something that was something relevant for us, of course, and we decided to focus on the approach of sharing our experience with these guiding principles that we believed it was really relevant for them and that we believe are really relevant in a co-creation process. And we believe this is robust enough to share with the people. But we never had the intention of being prescriptive, of saying, if you have to do something like that, you need to do this and this and this, because we had 3 different trials. They were very diverse, they were very different, and the needs on each one of them were very different. So we are not in a position to say, this is what you should do, and this is really universal and robust, and it will work in any kind of environment, because it is very dependent on the environment. But we learned that what we share as guiding principles is a good starting point of discussion and thinking and analyzing how you could apply it to your project, to your context, to your universality. So it's not a prescription, but I think it's a good thinking framework that could help in any kind of context.
Thank you very much, Mikel. Now let's turn to Amas. Satu,
Yes,
what would you say?
Yeah, this is very good question. I would say that we are not trying to be universal, but pluriversal. I think the whole idea is accept that there are many pluriverses existing at the same time, rather than trying to find something which is universal. And I think that applies a lot to social impact in arts, and especially we were working with vulnerable communities. So you have to accept pluriversality. I would not have some kind of answer saying that there is one tool fitting in all the cases. So I would rather, like say that please think about pluriversality.
Thank you. Matthew, I think you were the one who brought on the table the universality. So a quick feedback from artists.
Sure. In terms of the universality, speaking as a psychologist, I would argue strongly that I'm a bit incredulous with the idea that the different people would have wildly different responses, or your culture would say drive at a very basic psychological level different outcomes or different processes. So I think some of the work we've been doing with just collecting thousands of experiences speaks to this idea that if you distill it down deep enough, say, does it make you angry or does it change your mind? We can start speaking of universalities. At the same time, when you start building on, what are you bringing to the encounter? What is your personality? What is the artwork? What is the experience? What were you looking for? We start speaking to probabilities. And that, I think, very much can be driven by context and what you're looking for and maybe the background you have. So there's space for both. I think understanding the psychological universals is important, because then we can start talking about how we find some of these processes and effects that we might like to get in different populations or in different contexts and different settings. Thank you.
Thank you very much. And then unfortunately, we have to make a choice with the other question. So what about trying to see what the feedback of the 3 projects would be? How can we make the cultural sector less reliant on the political orientations? The second part of the question, can we ever take out the political out of policies? I think this would deserve a larger session in terms of timing, at least. So what about the first part? Who wants to start? From your project's outputs, I would say, from your experience in the project, when you were confronted to this, how did you react?
Well, I will start again, even though I don't have a very clear answer here, because it is difficult. I mean, I think that we really, I think that our approach, at least of co-creation and empowering or giving the opportunity to communities to be part of the artistical and the cultural approach, let's say, and giving them this empowering tools so they can really develop that and be part and be really creating new stories and meaningful ways of art. I think that could be a good way to be resilient in the future and to really promote something that will be less dependent on really promoting the actions, because it will really empower them, transform both the professionals, in our case of opera, that will have a different relation to society, but also to the different communities that at some point will be part and that will feel commitment in what is happening in the opera houses that maybe was strange for them in the past, and so on. So we really believe that focusing on the capabilities approach of the citizens and also in the co-creation could be something that could start a way that will reduce the dependency. But it's a complex question, so I don't know if it covers all the question itself.
Thank you. I invite Satu now for the project AMAS.
Yeah, I think this is again very good question. I would here say that it is almost impossible because the political programs decide about the use of money. But I think I would have very mundane and pragmatic reply to this, or trying to see how to solve it. I think this is one of our aims in AMAS to try to evidence the impact, so that it would be available as one of the tools in the same way than other tools exist there for professionals to use in the area of well-being and mental health, or even wider societal challenges. So I think we are trying to increase the understanding and the evidence, and also capability of organizations to buy art-based methods and art as one of the tools. I think this is one of the keys also, that there's a lot of different kind of tendering practices and budgeting practices. So I think there we would need to increase our impact and dissemination and approach to increase the capabilities and capacities of organizations to use and buy arts and understand how and the processes, how they impact. So I think this might be one of the keys here.
Thank you. And from artists?
I would largely agree. I think if you think of political as distribution of resources or interest or access or focus, there's always going to be decisions on where we're putting our emphasis. And I would just add that I think one way of maybe protecting against political changes, say dropping funding from the arts, for example, could be to really build this critical mass of awareness. And I think, for example, the workshop we're doing today is a good step, maybe EU-wide approaches and awareness that the arts really do play an exciting role in health and well-being and can be applied to everyone in a population. And maybe I would also add that one thing we could do is also work with how we're communicating the arts, maybe at the institutional level. Why would you visit a museum? Why would you go to the opera? Less from it has this intrinsical, even nationalistic importance to, well, you might have an experience that's good for you, or you might have something that is interesting or tailored to you, or whatever happens is somehow intrinsically important and special for you. And that's the resources the arts are playing. And maybe in that sense, if we can build up the protection and the awareness that the arts are this natural resource that is for everybody. I think that might be one way of becoming a bit apolitical. Thank you.
Thank you very much. I would like to apologize with the stakeholders who have asked other questions, but unfortunately, for the sake of time, we will not be able to take them. However, as I told before, we will keep them, and we certainly will analyze and build on them. With that, if the moderator of this second session is agreeing, I suggest that we skip the take-away messages because they have been included, I would say, partly already in thanking the three speakers and giving the floor to each of them. And we now move to the wrap-up discussion, which I promise will be quite short. So my first point would be on research and innovation. We all know that mental health is really a complex societal challenge, but it affects different segments of the population, people of all ages of life, and potentially all of us in our life course. So, as you know, the Commission has called for a comprehensive approach to mental health that also includes to increase the resilience of both individuals and population. In this frame, it is undeniable that research and innovation has a very important role to play, and you have demonstrated it. So first of all, a better understanding of mental health. We are also asked to deliver solutions that work for different specific needs, different groups of people, specific situation. You know, just think, as one of the projects said, about the COVID-19 pandemic. We also are asked to provide evidence to support effective policies. And this was the whole discussion about the measurements, the robustness, but also the universality. We are asked to design new tools and new technologies like AI, and we have heard one of the projects saying we have used AI-based solutions. Provide creative ways to address well-being, and mental health is included in that part, and I think arts and culture definitely are able to do that, and promote inclusive and fair European society. Now, the 6 projects that we have heard of today have been funded by the previous framework program, Horizon 2020, and we could really appreciate the richness and the variety of the scientific approaches, as well as the wealth of results that the projects have generated. I would say this is just the tip of the iceberg, because there are a lot of things that we do not know of these projects. More opportunities for mental health exist if you are a researcher interested in Horizon Europe, in several of the clusters of the framework program, but also in some of its missions. And I would warmly invite you to use our search engine to look into the funding and tender portal to check for the calls for proposals that are still open. As you heard our director, Irene Norstedt, this morning, she spoke about 14 calls for proposals alone on well-being, including mental health, across the 2 clusters, health and our cluster that we are showcasing today with these projects. So in the morning, in session 1, we heard about the broader concept of culture and its impacts on well-being. Some of the keywords I really liked and I captured were the engagement and the relationship between the approaches for individuals and also for communities. So looking at 2 levels here. Inclusiveness of unrepresented and vulnerable groups, but also we heard about the digital divide. The role of proximity also, a physical proximity between the artistic and cultural activity and the people. We heard about using of innovative tools based on artificial intelligence, the importance of having rigorous measurements, both qualitative and quantitative. We also heard about the need for replicability, sorry for that, and the need to have arts and culture as part of a strategy. Some of the projects spoke about their end results because they're simply finished. Other projects are still ongoing. We heard about the Manifesto for Cities, which leads us to speak about some practical suggestions. We also had two slogans: less money for pills, more money for arts. Maybe it was a bit distorted, but this was the essence. And the 4 Ps: pathways, protocols, partnerships, and policies. In session 2, we funneled more specifically to the impacts of the arts on well-being, including mental health. We heard a lot about participation, a lot about co-creation, but we also heard about the power of multidisciplinary consortia, in which clearly SSH disciplines and STEM join forces and are truly blended. They're really mixed, and from the start of the project, I must say. The question was also about theoretically driven approaches, but also the need to bring the empirical and the systematic approaches. We heard important words: patience, humility, trust building, in co-creation, connecting with people. I also like the word hopeful. And a takeaway was the co-creation must be at the heart of cultural policies. We also heard about the existing effectiveness and limitations of arts and culture for well-being. So these probably are some of the areas where research should continue to support work. We heard about agility. I really like the word. Participatory methods, but is also strongly linked to the co-creation, and recommendations to have return on investments, to put everybody on board, specifically also those who have the power to decide afterwards. Mentoring and knowledge of transfers, and then some questions: what, if, when, for whom, how. And among the recommendations, a very strong one: to make the right to freely participate in cultural activities for all. I also heard speaking about the technology ecosystem, which is very nice because this terminology is usually applied to other sectors. So I think we have to be a little bit more daring here. Now, on the mental health strategy, high on the agenda. It was already high in 2022 with a State of the Union address of President von der Leyen, where she said we should take better care of each other. In June this year, the communication on mental health was released. And what we heard was in the statement that our European approach is the first of its kind. Today, we are taking a major step to support mental health in Europe. I think this is a true call for action. As part of the communication, the Commission calls for best and promising practices. This is exactly what we're trying to do here, to share and to contribute with the arts and culture that are truly cross-cutting, how to support further the member states. And now, on behalf of DG Research and Innovation, the European Research Executive Agency, we would like to thank all the speakers and the listeners. With your presence, you have contributed to a successful, but most important, beautiful workshop. And for those who like figures, I can share that the participation reached its peak at 9:50 this morning with 91 attendees. I think we can congratulate ourselves for that. We thank also all the contributions of today, including from Slido. As said, we are going to capitalize on them. And from tomorrow onwards, we will continue to harvest and analyze the good results of the projects, especially those that are ready for being further translated. And before closing, I have to check okay, yes, there is an amendment. 95 participants was the peak. Okay, so my figures were not correct. Thank you, Matej, for that. So I would like to thank also all the team of colleagues. There's a lot of work behind this type of events. And this is really co-creation with all the projects, but also the stakeholders. And with that, we would like to wish you a very good lunch. So thank you very much. And congratulations to all the presenters. Thank you.
Thank you. Goodbye.
Goodbye.
Okay, thank you. Thank
Thank
you.
you. Bye-bye.
Thank you.
you.
Bye-bye.
Bye-bye. Thank you.